professional. You tapped in, no filter, no fluff, real rap every time. Yeah, we talking about health, from the boardroom moves to the barbershop facts. We keep it 100, never turning our backs. Mine sharp like a suit with the fade on point. Every convo cut deep, this ain't just for the joint. It's the culture, the hustle, the game and the grind. You looking for truth, then you came to the right line. Keeping it 100, facts versus feelings. Keeping it 100, truth with no ceilings. Keeping it 100, no cap, just vision. We speak it, we live it, your health is our mission. Keeping it 100, facts versus feelings. Keeping it 100, truth with no ceilings. Keeping it 100, no cap, just vision. We speak it, we live it, your health is our mission.
Welcome to the Keeping It 100 podcast, where we have open and honest conversations to make sure you have the information you need to make good health decisions. I am your host, Dr. Kristen Motley, and as always, I am joined by the incomparable, the one that really kept it 100 last week, Georgie Mink Jr.
That would be me. Good morning, everyone. Hey, Doc, what's going on?
Oh, we got Smooth G today. We got Smooth G in the building. All right, G. I wanted to thank you for holding it down last week. You did an amazing job. I'm like, wait, y'all wait till I'm not here to like really go in.
Yes.
That was good. So thank you.
Yes.
Thank you for being willing to be honest, for being open. And I know you changed lives with that.
Oh, yeah. Yeah.
I know you.
I got a lot of phone calls. Yeah, it helped me too, though. It helped. It was good to get it out on the show by myself. I didn't even have you there, so yeah, it was a good show.
I could tell at the end it was like a relief.
Oh yes,
like you tried to be smooth with it. But it's like, all right, y'all. Next week we're gonna be at. He was like, hold on. Let me take a breath.
I had to.
So I'm glad you took a minute
to
reflect on what just happened,
right? To
take it in and to really, just to really reflect on it.
Yeah, it was overwhelming a little bit, but I still was going with the flow. But you're right, I did have to breathe.
Yeah, I saw that breath.
Breathe. Right. Yeah, because it was a lot going on. There was emotions and stuff, and just talking about yourself is not easy all the time. So, But it was good. It was good. Like I said, I was on my own. I didn't have no choice, Doc. Yeah, it was sink or swim.
You had to hold it down. You had to hold it down. Yeah. So if anyone didn't check out the show last week, you got to go back and check it out so you can know what we're talking about. I'm not even going to tell y'all because it's so deep. It's so powerful. I think it'll move you in such a significant way that you got to look at it for yourself. Mm-hmm. Look at it for yourself. Mm-hmm. But one thing you said was that it brought you closer to God. That was like one of the most significant things you said. I love that. Yeah, can you talk about that a little bit?
Well, everybody's experiences is different. I mean, I always knew God. It wasn't I wasn't like a person that didn't know, but when you in certain times and you just feel defeated, and it was like they was like the emotions at the time. So I ain't have no other choice.
Yeah, well, you don't have nowhere else to go. And
I
you
try
feel like
every
you at
door.
The end.
Yeah, it's like when you try every door, then there's one left, and so it was like kind of forced to it. Like, so it was like, of course, open arms. Things start getting better. I started reading the Bible, actually.
I heard that.
Reading scriptures and just following along in my own little journey, not what somebody else is telling me or somebody else's way. I was on my own pace.
I love that. Yep. I love that so much. And what many of you may not know, I didn't know the extent of it. I didn't know all the details. Right. I just knew that there was a problem, and I just knew that I wanted you to get help, and I wanted you to want to get help. Right. And I didn't know all of what you talked about. So I was sitting there like, wow.
Right.
George is putting it all out there.
You caught me though. You caught me like with
I can't even take credit for anything because I didn't see anything. It was told to me.
Right.
And so I didn't know.
Right.
And so I just had to stand on that.
Right.
And so
I appreciate you. I mean, that's a true friend, and you didn't fire me.
Absolutely not. I would never
you
do
didn't
that.
Fire me. No, that was a joke.
I wouldn't do that.
No, it was just it was eye opening when you approached me, and it was just like, wow. Then that actually started the process.
I was surprised to hear that.
Yeah,
I didn't know
started
that.
the process, Doc.
I was surprised to
You
hear
put
that.
me in front of a therapist, and she was asking me stuff, and I still was like, still trying to be smooth. And of course, it was still a problem, but it was like that was the first time for me to start being aware of it. Like it's affecting your job. Then the way I looked at it, like we represent the community. You here with your friends, but you still was working, so it was just like. And then you confronted me, and it was just like, ouch. Like, Doc.
I know you was mad at me. I ain't care.
Really. I just was just like, wow. So you really going to like suspend me?
Yeah, you was mad. You was so mad.
And you were serious
because it was the only way for you to do something.
Right.
And I knew that you wanted to stay with Health Educated and you wouldn't want to leave. So I just had to hold you to that. I couldn't back down off of that.
Nah. Not at all.
I couldn't. And I didn't know what was going to happen as a result.
Right.
And, I could tell you were in denial, so I didn't expect you to go to therapy and change. I really didn't because you wasn't even accepting it at the time.
Right.
But I still needed you to do something because I was hoping that through that session, there may be something that said that may trigger something. I don't know, but I wasn't counting on it.
Right. And I was more mad that somebody told you. I'm like, man, somebody told you.
I know.
Or told what? Like
I
so
know.
It was just like, nah, but it was a good experience. Like I said, everybody's journey is different. And that's what this show is about. We use the platform to help people.
Yeah,
So,
absolutely. The other thing you said that I really, really loved was I'm allowed to have problems.
right.
I'm allowed to have problems. Like that was so deep because a lot of times, especially in this age of social media, everybody is posting the great days.
Right.
Everybody's posting the highlights. Nobody is posting about their struggles, their setbacks, their challenges, the tears, the pain, the suffering. Like nobody's posting that. And so I love that you reminded us that we are allowed to have problems. And we all have problems. We will always have problems. But no problem is bigger than God.
Right.
And he can overcome it all. But we just have to be in alignment and, do all the things and we can get through the hard times. So I just love that you reminded us that we are allowed to have problems.
Yeah.
It's okay.
Right.
It's okay.
Especially for a man, we always take things differently. And
that's
it's
true.
Like for us to admit it. And, I read something after that, like, cause some brother, he sent me this video after he seen it. So he was like, I want you to see this. So it was like a little script, little reel. And he was like, the man was like, Superman, Clark Kent actually was the real Superman. So he was like, so picture that. So you're not Superman. You know what I'm saying? So it was like, you walk around like, Superman, but Superman is not Clark Kent. Like Superman is really Clark Kent is his other person.
Yeah,
like he's not Clark Kent. He's really super.
Yeah.
So it's like sometimes we get that reversed. So it was just like it just bring you back down to human stuff and just your emotions. And it's a lot of mental growth with that. So you gotta like own it. We talk about accountability all the time. So that was the first thing I had to do. So appreciate you, Doc. You put me on the road.
No, I appreciate you for being open and for being honest and for the lives you changed in that podcast last week.
Yeah.
That was good. That was good.
Right.
I do want to give a shout out to the podcast team. This is the episode 18 of season 3 here. So we're at the end of our budget. So I don't know if we're going to have enough money for another episode.
Tell the truth.
That's the truth.
We out of money.
we about to run out of money. So we might be able to squeeze in a half an episode next week. I don't know, but let's just count on this one as being the last, and anything that come after will be the bonus.
Right.
So we might have a bonus episode or two. But I do want to give a shout out to the team because it takes a village. For the first 2 seasons, I was really handling everything. And I knew that if we brought the podcast back, I would not be able to handle anything. I would need to just show up. And that was it. And I have been able to do that because of Crystal and because of Francis and Sarah and Layla and Dr. Orozco. They have been incredibly amazing in pulling the show together and allowing me to just come and show up. So thank you all so very much. Look at that beautiful team of women. May I add, during National Women's History Month. Pierre gave me a look, y'all. Y'all can't see him, but he just gave me a side eye. Okay.
We gotta give P a shout out too.
we do appreciate Pierre for always coming through and always being there when we need us and having this platform.
Right.
So just even having the platform, having the reach, and for giving us the opportunity to, to put the word out there, because what good is it if nobody is getting it?
Right.
So we appreciate him. We encourage him. We know, he over there doing this podcast thing, yo. Y'all should see him. He is the broadcast journalist of the year every year, in my view, because he has very limited resources, but he's making very big things happen. And so we're proud of him. We are proud of him during National Women's History Month. We are still proud of our men doing their thing. So thank you, Jean-Pierre.
Flowers.
Thank you. So today we are going to honor a pillar in our community. This is George's moment for his Women's History Month recognition. Who are you recognizing today, G?
Miss Lynn Johnson.
Yay, Miss Lynn.
Appreciate Miss Lynn. I was going to read her whole bio, but her bio is like an hour.
It is.
Change. But like Doc said, just tell it from my heart. So I'm just going to say how I experienced her. Just working through the community. She acknowledged me one day, and we just never took eyes off each other. She's a sister of the minaret. She does a sickle cell program. She also has sickle cell, so we actually did events with her. Just a beautiful, powerful woman in the community, and I owe a lot of the things that I learned from her. Yeah, so
amazing.
Just want to honor her today.
Thank you, Miss Lynn, for all the things, for being such a dedicated community member, for doing all the blood drives and the sickle cell awareness. And fun fact, Miss Lynn is my aunt, and I didn't know.
Wow. Oh, yeah, you did tell me that.
So her daughter, Janir, is married to my cousin Bobby. I did not realize that.
Wow.
I think it was at a funeral that we realized we were related. You know how that happens sometimes. So yeah, that was cool. So we kinfolk. Right. We kinfolk. But today, y'all, as you see, we are live at, well, you may not know where we are, but we are live on site. We are at the Delaware County Health Department in the great city of Chester, Pennsylvania. And today we are joined by Laura Werner, the director. She first joined the health department in April of 2022 as the deputy director when it was newly formed, and she was promoted to Madam Director in November 2024. Prior to this role, she had over 30 years of experience working in public health at the federal level and in consulting. Ooh. Welcome, Laura, to the show. Yay. You're welcome.
Nice intro. Wow.
Stephanie Reese is also here with us today. She serves as the Deputy Director of the Delaware County Health Department. She has been with the health department since its early formation, initially serving as lead nurse of the COVID-19 task force. She later held the role of administrator of personal health, where she led and oversaw key public health programs. Welcome to the show, Steph. Yeah. You got to pick up your mic. So I just want to start off by asking, what is the Delaware County Health Department? So I work in public health now, but I didn't come up in a public health career. So I still am confused in terms of what you do and when I should call and when I shouldn't call and stuff like that. So tell the people, what is the health department? What is it that you do?
Sure. I'll start.
Yeah.
So public health is about prevention, and it's about promoting health, right? And so if you're not sure if you should call us. That's the answer for that.
Yeah.
We have a number. It's like our one-stop shop number. Just call us. If you're worried, you want to get a vaccine, you're not sure where to get a vaccine. You're a former Crozier patient, you can't get your medical records. If you're, a young mom and you're trying to figure out what resources are out there that could help you have a healthy family, just call us.
Okay.
Let's see if we can help.
I love that. So just call.
Yeah.
Just call. If it's a health related thing, call and you can point them in the right direction.
We may not be the answer every time,
Yeah.
but we have folks that are in the office every day, their job is to take your call and talk you through, do we have a resource that can help you, or can we help you find somebody else that does?
That is so easy. I love that. Just call. You don't need to know what we do. That's what she said. It ain't your business. Just pick up the phone.
You'll find out when you
and
call.
I mean, public health is the very traditional things that people think about. It is vaccination. It is, STI testing and treatment. It's helping patients with tuberculosis. It's that bigger picture, connecting the community, doing prevention work. That it's kind of harder to describe in a way.
It is. So we are at the Delaware County Health Department in Chester, but a lot of people, and you've been here since 2022, but a lot of people still don't know where it is, and there's confusion because when you put it in your phone or Google it, you can put in Delaware County Health Department, Chester, PA, and it doesn't come up. And so I know that you've been behind the scenes working on that, but what is the actual location? What's the address?
We are at 5th and Penn.
And Penn.
Right here in Chester. And, a lot of people know the probation office is right next door, but we have a whole separate independent access, and it's private, and it's the health department office for the county. Before we were here, it was the state health department, and there is some confusion because Google never forgets, apparently, and Google will, if you put in our address, or even you sometimes search Delaware County Health Department, it'll come up with the old Pennsylvania name, and what's worse, the old Pennsylvania phone number. So don't use that phone number. Look for the 484 Delaware County Health Department number, that old 610 number.
Don't use
It's not answered. It's not us.
The number's 484-276-2100. And you'll hear me say that a few times in this episode.
Right.
Good. Keep repeating the number so people
But
know.
can I add something about the address just to give some history of how we changed on our website? We used to have 151 North 5th Street. It was a Chester resident that said that does not resonate with us. Change it to 5th and Penn. So that's why when we talk about the address, we say 5th and Penn.
I love
it's
that.
a Chester resident that said, that 151 does not.
This is not telling us where
It's
it
not
is.
telling us.
Right.
We know 5th and Penn,
Yeah.
So, we listened to the community and updated that.
Thank you.
That's good stuff.
And I know how Laura stayed on brand. I said,
Okay.
what's the address? Laura said 5th and Penn. I was like, okay.
Right. That's what you told me too.
Did you have anything?
No, I mean, I was going to say how long you have been here. You had told us that. What's the connections with the other health department? Like, are you guys?
With the state health
Yes.
department? Yeah, we definitely are connected. We have independence, but all the disease reporting that comes in, all the blood lead testing, all that, the vital records, all that's at the state level. So we work with them to get some of the data that we use. They have oversight over a lot of the things we do. A lot of the funding that we get comes from either the federal level or the state level to us to do the work that we do.
Okay. So by you representing Chester, do you get the data from things that's going on, like problems or diseases that might be affected in this area specifically?
Yes, absolutely. Yep,
Okay.
we get that data, and it's private data, but we protect that, and we can see where it's coming from. We know the person's address.
Got you. So that would entail with the needs of the area of the community. So whatever is going on, you would know firsthand, like if it's not an epidemic, but something
An outbreak or something.
that's
Sure,
an outbreak or
absolutely.
something. Okay.
Yep.
Okay.
Yep. That's
Okay.
real important.
Okay.
And the state is providing you with that information so that your team can take the next steps or, to alert the community to address what's going on. And
Work with partners if there's something we need to do, or
Yep.
if it's related to a restaurant facility, we'll work with that team.
Nice.
That's exactly right.
Okay.
what are some of the public health initiatives that you are promoting right now?
Well, I'm wearing a shirt, and I don't know if you can see the back of it, but this is our
Oh,
a lot
yes.
of work that we partner with you, Dr. Motley, on in Chester and countywide about lead poisoning prevention. So Julie wanted to highlight that. We got some of the board books that we give away and education that we have about that. We got this great Iron Man poster that kind of helps kids understand iron's protective against lead. So we really just trying our darndest to work together to increase screening for lead poisoning in our families in Chester and in the whole county, and also connect families to what they can do about it. But it's been challenging, and I know you might ask that later, but it's hard. It's really, the housing stock is older, and affordable, safe housing is in short supply. It's a real challenge.
How bad is the lead poisoning problem in Chester?
You know, Chester.
Yeah, go ahead.
You know, go ahead.
I was going to say, is it worse than other towns throughout the county?
We've identified a few towns of the 49 municipalities in the county that are of highest priority for lead exposure risk, and Chester is one of them. Upper Darby is one of the other. You know, we work in Lansdowne and other communities that that have high prevalence of both the risk for lead poisoning and the number of kids with elevated.
Wow.
So we're doing our thing to try to let the community know, to try to spread the resources, and we're really grateful to have the health department and all the resources that you bring that allow us to get a lot of the work done and to connect people to you. So that is amazing. What other initiatives is the health department running?
Well, we're guided by 3 big priorities under our community health improvement plan, and it's chronic diseases, it's maternal, parental, infant health, and it's whole person care, which includes mental health and substance abuse disorders. So we're doing work in all 3 of those areas a ton. Under the whole person care, like we're trying to get out as much as we can awareness about Narcan, and we're providing CPR classes and stop the bleed training. You can access any of that for free. Just call us again. We'll try to set you up. We've got the public health vending machines that are out there, and I want any Chester residents to know you can go there 24 hours a day. That machine is at Keystone First. I wrote down the 1929 West 9th Street.
Yep.
By the Family Dollar, and it's there. It's outside, so the stores don't need to be open. You can just go there, get Narcan anytime you need it. There's also other public health supplies in there: first aid kits, STI tests you can take home, COVID home tests. It's a lot of what we're trying to, harm reduction and making it accessible to people
Right.
to get to. What else? We do so many things in the maternal child health space. I mean, we partner with you on this too. I know we just feel for our Chester families and the lack of resources for our young moms. We're trying to increase the availability and training of doulas and birth companions. So again, if you want one, you're trying to get connected to one, call us. We'll try to help. Should I stop talking? Is this too much?
No, we want to know what you do.
Wow.
You on the roll.
We on May 4th, we're trying to do a soccer themed event because, of course, it's a year of soccer, right now, for kids and families. Where we'll be at the stadium. There'll be giveaways. There'll be screenings. We're going to really focus on some asthma education and awareness. 'Cause again, asthma is a real concern for so many families here.
So true. What have been so I know you have a lot of programs that you're running right now, and you've made a significant impact over the last almost 4 years that you've been here. Is there going to be a party?
I don't think so. Like a public health party.
We're going to be outside. So there's a lot of great things that have come out, but I'm sure it hasn't been easy. What has been challenging, would you say? Anything come to mind?
Well, we have to talk about the Crozier Health System collapse. It's hugely impactful and challenging for families here. Trying to connect people to care, have them still retrieve their medical records, just where to go. I really appreciate partnering with you and the city on what we're trying to do. But I think another big significant challenge has been that issue of safe and affordable housing.
Yeah.
Oh yeah.
I can't get away from that one. That's one huge. But also having people even know who we are.
Well, that's what I was going to say.
Yeah.
Just again having people understand that we are here in Chester to support, to help, to provide that care that's needed around these some of these initiatives that we're trying to implement, such as immunizations. We have a VFC. Vaccines for Children is a free program. We don't see people coming out to take advantage of that. We do free STI, sexually transmitted diseases or infections, free testing and treatment. We don't see folks coming out for that. So just really trying to get in the community, say we're here, it's safe, it's confidential. So that's one of the hurdles that we're trying to get over. And hoping that, being more visible in the community will help people understand where we are and what we're doing.
I know you also have a location in Yaton. Do you get more people that come in for childhood
Immunizations?
vaccines and
Absolutely.
STI testing?
So it's almost flip-flop. So because this location's been known more so for the STI treatment and testing prior to us becoming a health department, it's kind of a continuation. So, Chester people know that we're here. And Yaden, we see a lot more immunizations and vaccines. So a lot more folks coming here. We're holding a clinic here once a month on Mondays, and we may see 1 or 2 people.
Okay.
And we were here every week, and we had to set it, kind of set the times back because we weren't.
How were you getting the word out? I don't even think I knew about that. So every week, every Monday.
It's the free vaccine.
It could be every Monday. It's as needed too. So if someone calls, they're like, we're in Chester, so we'll make sure it's the nurse there to do the immunizations. But a routine day is the first Monday of every month from 10 to 2.
Every month on the first Monday from 10 to 2. But for childhood vaccines, I imagine they may go to the pediatrician. So I wonder who would come here if their children are going to a pediatrician.
So if you have insurance, so if you don't have insurance, you can come here and get your childhood immunizations at no cost. There's no administrative fee. There's nothing to it. So yes, if they have a pediatrician, we recommend that you go to your pediatrician if you have one. If you're uninsured and you don't have a pediatrician and you need to get your child.
That makes sense. Okay, that makes sense. Very good. So y'all come get your kids vaccinated first Mondays, 10 to 12, no appointment necessary.
Oh, no appointments are necessary.
Appointments necessary.
I thought it was a walk-in.
No.
So
you
because we
schedule
want your
it.
medical records. Yeah, so we want time to be able to review medical records, see if eligibility and things like that.
I got you. So schedule it.
And it's back to that number.
Call the number, staff.
484-276-2100.
Okay.
All right, good. Is there any myth or misinformation that's floating out that you may have heard that you want to set the record straight? This is your chance. Set the record straight. Tell the people what it is. Anything?
Well, we kind of addressed some of that. Where are we actually in Chester? Do we provide more than just STI testing and treatment? And we absolutely do.
Yeah.
So that's a big one that we wanted to address up front.
You also talked about the fact that you're helping people get their medical records. So for those of you who don't know, your medical records from Crozier will not be available after, I guess, a year.
Yeah, March
about
2nd.
a year from now. And so they will not exist. So if 2 years from now you need a procedure, you need your kids' immunization records, and they went to Crozier Pediatrics, you won't be able to get them. So now is the time. Now is the time to get your children's, to get yours, your spouse, your loved ones, get all of your medical records from Crozier, because they are going to be destroyed and you won't be able to get access to those things. And in fact, if your child goes to college or camp or wherever and needs their vaccine records and you can't produce them, they have to get all those vaccines over, because if it's not documented anywhere, it did not happen. And so you don't want to have to repeat vaccines if that you won't be able to prove that you have the immunity against the disease. You don't want to have to repeat those vaccinations. So please get your records. How could they get help with getting their records?
Yeah, they've set up a website, and you can do it yourself. It's no problem. But if you find that the process isn't working for you, it's confusing, you just can't figure it out, or you've tried it and it didn't work, we just invite, again, people to call us, and we'll try to help you individually. And we're also going to be restarting the series that we did last year, where we have in-person walk-in sessions where you can just come and talk to us about, bring your ID, you don't need an appointment, and we'll go through it right there with you one-on-one. The next one that we're going to be hosting is, I think it's March 28th, and we're going to host it at ChesPen in Chester.
Okay.
And you don't have to be a ChesPen patient to come in. We're thinking we will get folks that are there for their appointments and their normal activities there, but anybody can come in who's having trouble getting their records, and we'll try to help you. And we'll be doing that all throughout the year. Just keep trying to give people that in-person support.
That's important. So Saturday, March 28th at ChesPen, Appointments necessary?
No appointment. Nope, that's a walk-in one. Sorry, yes. Thanks for asking.
No appointment necessary. Walk in. You don't need to be a chest pain patient. What's the hours?
I got to look that up. Okay.
All right, y'all call the number.
Yeah.
Steph, what's the number?
484-276-2100.
I'm going to look that up, though, while we're talking.
That's all good. Thank you for doing that, and thanks for being willing to come out to the community to really connect with them and to make sure they have what they need. G, anything come to mind? Medical records?
I just appreciate them. Like, it's just another resource. So again, to the community, we got to take advantage of these resources. It's free. It's quality people that's willing to just help you. I mean, that's the main thing for me. Like, it's so many resources. Like, every time I hear from when they speak, it's like, wow, all these things are available. And we got to start taking advantage of these things. I'm just talking to the community. Mm-hmm. We got to. I mean, that's what they're here for, So we're going to do our best, of course, to get all the initiatives and, get the word out. But I'll get taken aback every time I hear all these free resources, Doc. Like, it's so many. Like, go ahead, Steph.
Yeah, I just want to talk about one that's not talked about a lot.
Let's do it.
Our teen clinic.
Teen clinic?
Really?
Teen STI clinic, yes.
Wow.
It's not talked about a lot. It's every other Tuesday, 3:30 to 4:30. This is where we offer our teens, because we can't get into the school districts right now to be able to do the sexual education, to offer free condoms.
How come you can't get into the school district?
Well, so just a lot of red tape,
Okay.
Right.
So administration, parents sometimes don't want that offered to their kids in the school. So we really want to be able to talk to our teens about sexual education, about STIs, help them prevent it. And we're not really seeing the reach, reach with them yet, So if we can talk about that some more and let them know we're here. And I think a lot of times they think we're going to tell their parents. We cannot disclose to a parent if they're 13 or older. So we can do their testing for free, their treatment for free, and it's confidential.
Right.
Wow. So, and I know some parents don't like to hear that.
Right.
But we want to keep our teens healthy. STIs going too long sometimes can cause infertility. Things like that. And we don't want that for our babies.
No, absolutely not. Have you connected with any of the after school programs in Chester? There's a ton of after school programs that would probably love to have you go in and engage with their young people.
We have made some attempts. I think we're still trying.
I got you.
Okay.
Oh yeah,
We
for
gonna
sure.
make that happen.
For sure. Right.
Because if that's a problem and a concern, then it needs to be addressed.
Absolutely,
It needs to be
absolutely.
addressed.
And I heard in the beginning of the podcast somebody snitched on you, told on you. I want everybody to hear this podcast today and run tell that. Okay?
Right.
Go tell.
Right.
Tell your neighbor. Go tell your neighbor.
Yeah.
Right.
Tell that. So, and I just want us to try to get as much information out about the programs we're offering.
Yeah.
Again, at no cost.
No cost. So
Right.
talk about the teen clinic is
Every other Tuesday, 3:30 to 4:30. So we designed it for them to get here after school.
Right here.
We also,
Okay.
in some
Wow.
cases, where if they're like, we can't get there, we can offer SEPTA passes. I think we do have
Really?
that
Oh,
we're
wow.
willing to give to
Okay.
them to get here and get back home. So again, it's to help, prevent them from getting these STIs and pregnancies.
Right. For sure.
And they can
That's
access
big.
those machines too.
And they can access the
You can-
machines.
And then we will then follow up with,
Yeah.
with help.
Yeah.
With the results, so that you can
Yeah.
anonymously go get your test, but then let's help you get better.
And the myth I want to debunk with that is we will not tell your mommy and daddy.
okay.
Right.
Yeah,
Right.
absolutely. So they come here to be tested, or is there
They can come here to be tested.
anything else that happens during the teen clinic? Is it like conversations?
Conversation, absolutely. So our disease investigators are well trained in talking about sexually transmitted diseases, sexual health, fertility, all those things. So they will meet privately, in one of our conference rooms or one of our exam rooms to have these conversations. They can come just for the conversation. It doesn't have to be for condoms
Yeah,
or
just to
Right.
talk about
yeah,
it.
Right.
yeah, absolutely.
No, but y'all did have somebody that was going out to the schools before.
We
Yeah,
have
they came out with us.
Ibrahim. Yes,
yeah.
So he has to be invited, and we kind of like edged him with you, I think.
Okay.
Yeah. So
I got y'all.
All right.
Right, for sure.
No, we got to make
Thank
that
you.
happen. Absolutely.
Found the dates.
Okay.
Okay, it's a
Chess
time.
Pen.
It's Chess Pen, Saturday the 28th from 12 until 3.
Okay.
Okay.
12 to 3, Chest Pen, Saturday, March 28th. If you need your medical records or anything related to health, just show up.
And the number again is 484-276-2100.
Very, very good. Do you have any other locations, or is just Chester and Yaton?
Well, yeah, we actually have our environmental health division that's now at Rose Tree Corporate Plaza, kind of across from Rose Tree Park, media address. So that's where environmental is. Our admin office is still at Eddystone right now.
Okay.
But we're going to be consolidating with our Yaden.
Oh, okay.
Nice.
Okay.
By the end of the year. So it's, but technically we have 4 locations right
Yeah,
now.
yeah. So let's talk about environmental health a little bit. What does that team do?
Those are the inspectors that are going out and licensing and inspecting commercial food facilities. And institutions like daycares, and they also run our mosquito-borne disease control program.
Oh, wow.
So from May to October, they're doing surveillance for vectors and trying to control when we see problems. Yeah. What else am I forgetting on the environmental side?
forgotten
Okay. They're a great team, and you might see them driving around sometimes.
One thing that came to mind when you mentioned environmental health and the inspectors, a problem that came up recently with the union had a game and somebody put up a barbecue and was just cooking and selling food, but it wasn't inspected. And so can you talk about like what is the requirement around people who sell food?
Yeah. So
Yeah.
if you are not, even if you are just giving away food, it's
Oh.
okay. You don't have to be for sale. Any food that is temperature controlled, so it needs to be hot or cold. that is something that comes under health department authority. So these temporary food events, just call us. You're going to be serving food. Let us know. We'll talk through what you need to do and get you.
Okay. So you do want to let people know that there are some expectations if you are giving out food or selling food to make sure that the food is safe, so that it's going back to public health and disease prevention. We don't want people to get sick from the food that you are distributing. So make sure that you get in contact with the health department, have conversations about what's expected and what needs to be done to make sure that people are safe.
Perfect.
That's all it's about.
If you're just giving away packaged food and it doesn't need to be bags of chips or something, that doesn't come under our authority at all.
Thank you for clearing that up.
Right. Wow.
G, anything?
No, I'm just loving the the vibe in here with the free information and references and something Steph said with the kids, because I worked with kids a couple years ago, and it's really needed. And we had a meeting with Health Educated, and we was talking about the percentages of STDs with the youngest, like with the teens, like it's like at an all-time high. So it's definitely needed. I will definitely be promoting that to like different organizations that I know work firsthand with the youth, and you'll be hearing. So what about boys as well, right?
Oh my, absolutely.
Okay. All right. I'm just making sure. I didn't know. I didn't know if it was just okay. Okay. Because we got our young men on the football team and some of the different organizations, so I could reach out to some of the coaches, and we'll do some heavy connecting.
Yeah, we would love that.
Yes.
I think what's probably going to work well is you going to them. They're probably not going to come here. They might not come here. So as much as the health department can go to the groups, you're going to get them if you show up where they are. They're not going to come here after school. They're not going to come here after school.
And it's tough.
I wouldn't come here after school.
Right.
But if you at the place where I am, I don't have no choice but to listen to you. So as much as you have capacity to go out, and it's not every day, but as much as you have the capacity to do it, that is where you're going to see the numbers.
Yeah, the barrier there is being invited to do teen
don't
sexual
worry.
health.
Right.
I got that.
Right.
And also, it's very resource heavy to get
Right.
out and
Yeah.
about. But
Yeah,
we
that's-
are moving into this next phase. Where this year, we're hoping to have
Oh,
a
our
wellness on
mobile.
wheels mobile
Yeah.
unit,
Oh, yes.
which will allow us to do more work on
Right.
site in different
Yes.
locations. So we are looking forward to that too.
Yes, yes. I think that's another key part of that solution.
Yeah. Yep.
Yep. Very good. Well, this was really good. Can you remind us how to get here and where we are and how to contact you?
So I'm gonna let Director Werner tell us where we are.
Fifth and Penn.
That's
Fifth
right.
and Penn, right here. And our
On
kiosk
brand.
is on 1929 West 9th Street. So
Okay.
And you can reach us at 484-276-2100.
Okay.
Excellent. Thank you, thank you, thank you. And our last question for the day is, what is the most informative and entertaining podcast in the land?
keeping it 100.
Keeping it 100.
Okay. You got it right.
Good job. Good job. Thank you so much for being here today, for your time. We know you are super busy, but hopefully we are able to get some people connected to you.
Yeah,
Thank
for
you
sure.
all you
so
do.
much. We appreciate you so
Thank
much.
you, Lorna. Thank you, Steph.
you're welcome.
Yes.
Thank
Reminding
you.
us.
Yeah, of course. We have some events coming up. We are canvassing on March 28th on the east side, door to door, to make sure people know about lead poisoning, getting connected to lead resources. So that's March 28th. If anybody want to volunteer, you can come out, scan the QR code, register. We'll make sure you're trained and you have everything you need to come door to door with us. That's always fun, right?
Sure. Of course. And we feed you.
And it's getting warmer. Because
Yes.
the last 2 times it was
Oh,
freezing. It was
man.
snow on the ground.
Right.
We was freezing to death. It's getting warmer.
Yes.
So it's more reason to come out
Yes.
now.
Come on out.
We have our Dream Expo. If anyone has been following Health Educator for the last few years, we started the Dream Expo 2 years ago to expose underrepresented middle school students to advanced careers in healthcare. So if you have if you are a parent of a middle school student, please bring them out. It's going to be on Saturday, April 25th at Lincoln University. We are going to have veterinarians and dentists and surgeons, pediatricians and nurses, of course, pharmacists, all the advanced health professions will be in the building to expose and teach your child about their careers, to inspire them to pursue careers in healthcare. So
Yes.
that's our big event on April 25th. So come out. That's free. It's food. It's all day. Gee, am I missing anything?
No, I love the expo.
It's
That's
fun.
like one of my favorite events. So come on out. I guess we'll be getting the flyers out, Doc.
Yeah, it should be on the screen. Is it on the screen?
Okay.
All right, never mind. It's on the screen.
Okay. So register your
we got
children.
flyers, yeah.
We still doing the free transportation.
Yeah, so we'll have free transportation from
Nice.
Chester, from Wilmington, from Philly, and Camden if we need to, because we did have some families come from Camden one year and we gave them gas cards because we didn't get a whole bus. It was like 10 of them.
Yeah.
But yeah, so wherever they come from, we will make sure that there's no barrier for them to get there. That's important. And then the blood pressure program, we just got an email from the state that they are giving us another contract for another year.
Oh, wow.
This is our 4th year doing the blood pressure program. I added up the numbers. We've had over 100 people through the program, and that is not because of us. That is because of you. That's because y'all show up, y'all come, you want to live better, and you're allowing us to help you do that, and we are grateful for that.
Right.
So thank you to the Pennsylvania Department of Health. Shout out to Whitney for extending that so that we can continue to offer blood pressure management program in the community. That's all we got. We talked about the hospital. Oh, well, I mean, I guess, so we have a potential, well, I guess Christiana Care is coming to town. Well, not here, but close in the county. And we were going to talk a little bit about what is the impact you feel like that would have on the county.
I mean, there's definitely still a lot of uncertainty about what healthcare is going to look like in Delaware County now that the closure system is closed. But one of the things that's coming in, you're right, is 2 of these, they call them neighborhood hospitals that Christiana Care is building. And the first one is in Aston. I think it was May, so it's pretty soon that they'll
wow.
plan on having that open. It's the kind of thing where it's got to, a 10-bed emergency room. It's just clearly a whole different scale of
Yeah.
what we had and what we lost. But it is something that will function and add to the resources nearby, but not in Chester.
Right.
That came fast too, because I feel like when they first announced it, it was like 2026, and it seems so far away, but it's here.
Yeah.
It's here, and it's gonna be in Aston. You said
Aston is the first one. Yeah.
okay, all right. So that will alleviate a very small percentage of the overwhelm that I know is happening at Riddle and that's happening at Mercy Fitz. And we'll continue to do what we can to, try to restore what healthcare should look like in Chester for the people of Chester, because that has to be done. That absolutely has to be done. But we're gonna close out for real now. Thanks, P, for reminding me. I forgot a whole story. It was great having y'all this season again. If we can, we will have some bonus episodes, and we're gonna find that out in a couple days.
Right.
All right, everybody, have a good day.
All right. Thanks.
Truth with no ceilings. No cap, just vision. We speak it, we live it. Your health is our mission. Facts versus feelings.